Hi everyone, this is Dr. Konstantin. I'm a facial plastic surgeon and a facelift expert. And today we're going to talk about a very costly cosmetic surgery around the face and maybe possibly more affordable alternative to it. Because not everyone has it in their budget to invest thousands and thousands of dollars into a facelift or a brow lift, but at the same time they look in the mirror and people say, well, I really don't like how this looks. And this could be just about anything around the face. So what are the options? What else can we do other than resorting to very expensive cosmetic surgeries? Are there just cheaper alternative? So let's start with the forehead. So in a forehead, of course, we would do a brow lift. So cosmetic surgeon would do a brow lift to elevate the brows, change the shape of the brows. When face ages, the brows start coming down and that creates that crowding around the eyes and makes somebody appear more tired. At the same time, there appears quite a few wrinkles around the forehead. So brow lift is expensive cosmetic procedure. Now, what else can be done there? Well, we could do a few other things that definitely would not cost you as much. And BOTOX is one of those things. So you can lift your brows, not just by doing a brow lift surgery, but you can do it with BOTOX. Of course, there are certain limitations. You can only do it up to a certain point, and it doesn't work for some people and works beautifully well for other people. So no, unfortunately, 100% guarantee here, but definitely it would be worth a try before you go and do surgery around your forehead. Trying BOTOX can do wonders and make you very happy with how you look, so you wouldn't even want to do anything else. Next one is BLEPHAROPLASTY. And BLEPHAROPLASTY we do to remove the extra skin on top of the eye and also those bags underneath the eyes, right? So BLEPHAROPLASTY is a wonderful procedure and it works beautifully well. It could be costly for some people. So what are the other things that could be done? Well, using the fillers to hide those areas of deep indents that typically run right around the bags, or using the fillers around the brow to help hide that extra skin that you might develop on your upper eyelids, would be a much cheaper alternative to getting a blepharoplasty done. Now, again, it doesn't work for everybody, and typically it works very well in the early stages of aging. And once those bags become very heavy, using fillers, they're really not going to hide them, and it's not going to be helpful. So, but if you just started seeing the shadow underneath the eyes and maybe a little bit of extra skin on top, then you don't have to jump into surgery. You can use filler to make it look better. And the next one is the area around the cheeks. And a lot of people notice as they age, the cheeks become flatter and they start sagging and they just lose volume. They don't look quite as high anymore. And there could be some surgical procedures to take care of it, like a mid-facelift or a cheek lift that could be done, making incisions around the temple and pulling everything up. Another procedure, for example, would be putting an implant to make the cheeks appear higher. Now, all of those things work very well. Of course, they cost a lot of money, but nowadays, not just people who want to do cosmetic procedures on a budget, but the doctors and the surgeons prefer to use fillers around this area. So either we use temporary fillers to improve the contour of the cheeks and lift them up slightly higher, or we can use something that lasts far longer, like fat grafting, for example. We can take the fat from somewhere in the body where people usually don't like it, right around the belly, for example, and then we can put it around the cheeks to create the volume and improve the contour. The next one is the area around the jawline. And this is the place where a lot of people start noticing once they get to their maybe late 30s and 40s, just a bit of a shadow and the lines. And that comes from that extra skin that starts sagging a little bit, forming the gels here. And it's one of the earliest signs of facial aging, and this is what we do a facelift for, or at least a mini facelift. Now, a lot of times there are other things that could be done to postpone a facelift, not necessarily do it right away. And for example, one of those things could be a use of threads, right? So threads This is a surgical procedure, but it's not surgery, so it's definitely far less costly. The threads are inserted, usually starting from the temple and just running down underneath the skin. It can catch those gels and just lift them up. So this would be a good way of getting rid of the gels, although, the results, of course, is going to be temporary. Now, another way of hiding the gels would be injecting the filler right in front of the gels, just to create that continuous line from the chin to the angle of the mandible without the interruption of the fullness from the gel, so the fillers can actually hide the gels quite nicely. Another alternative could be energy devices, energy tightening devices, and there are many names, many companies on the market. I don't really want to help them to market their products at this point, but they use either ultrasound or radio frequency to tighten up the area around the gels and under the chin. Lips. Now, the lips are extremely important. A lot of people notice that with age, lips just become thinner, they lose volume, they develop the wrinkles, they run around the lips. And it's one of those areas where actually I personally don't advise to get surgery. I really suggest when people start seeing that those aging changes of the lip, rather use fillers, maybe a touch of BOTOX, maybe a little skin resurfacing if you have those lines around the lips, but not necessarily go and make some cuts and do some kind of a surgical procedure to make your lips appear fuller and make them appear more youthful. Now, the reason for that is that fillers actually look a lot more natural than, or typically I should say, fillers look a lot more natural than when somebody goes and tries to do surgery around that area. Now, the area also very much related to the jawline is the area under the chin, right? Or somebody's neck. And that area, of course, when a lot of people start seeing aging changes, a bit later than the gels, typically in this area, people get either fullness or the skin starts sagging. So doing a face and a neck lift would be a very traditional and very successful way of getting rid of the skin, but there are definitely other things you can try. Some people try putting the threads in there, or use of those energy devices that we talked about before can help to melt the fat and tighten the skin underneath the chin to make this area appear flatter and get rid of that tissue sagging. So putting it all together, now, there's a lot of things around the face that you can become unhappy with as you move from one demographic group to the next one. But it's good to know that there are alternatives. There are certain things that definitely would require surgery, but there are other things that may not be as costly and they may work quite well. So as long as you equipped with the knowledge, you can make the right choice for yourself.